30-year-old women with children should not be fighting cervical cancer. Sadly, I have seen 2 of these young mothers in the last week. I am Dr. Lori Spoozak with the University of Kansas Cancer Center. Several months after giving birth to twins, a patient I'll call Kelly was having irregular bleeding. She saw her gynecologist, who noted mild changes on Kelly's pap smear, but the bleeding wouldn't stop. Within 6 months, Kelly was in my office with advanced cervical cancer. Kelly, who recently completed chemotherapy and radiation therapy, brought her 3-year-old daughter to our last visit. I had good news for them. Kelly responded well to treatment and was in remission. My second patient, I'll call her Dana, is a mother of 2 boys, ages 8 and 10, and she is not as fortunate. She came to me with progressive cervical cancer, which did not respond to chemotherapy or radiation therapy. Dana no longer has the strength to care for herself and must rely on her family for assistance. At 32, this young mother is facing an incurable cervical cancer. Our time now is spent addressing her palliative care needs to improve the quality of her life in the time she has left. Cervical cancer is predominantly caused by the human papillomavirus, or HPV, and today this is a preventable illness. Pap testing has reduced cervical cancer rates significantly in industrialized countries, but it hasn't yet brought the number of cases to 0. Both of my patients had regular screening exams, and yet their HPV-related cervical cancers were not caught in time. We can and we must do better. A vaccine that targets cancer-causing HPV has been available since 2006. An improved 2-dose version of the HPV vaccine, which targets 9 different types of the virus, was approved by the FDA. For 10 years, we've had a vaccine that can prevent cervical cancer and multiple other HPV-related cancers, and yet millions of adolescent girls and boys are not being vaccinated. My hope for the future and my challenge to our community is to support the vaccination of girls and boys against the HPV virus so we do not have another 30-year-old mother facing an incurable cervical cancer diagnosis.